So at the time when ASU first started, I'd been working colorectal as a nurse practitioner, and I basically just worked alongside the junior doctors and just did I prescribed, but I just did basically what they told me to do. So if this needed doing, I go off and do it. Pick up jobs on the ward round and just, it was all very much sort of protocol led and, assisting with the medical team. With the nurse practitioner in ASU, when I am in ASU, I would see a patient as they come in the door, I'm clerking them, I'm making the decisions, I'm going to order the x-rays, order the ultrasound scans, start all the drugs without speaking to anybody. That's just what I'm going to do. I'm going to make a provisional diagnosis and then hand over to the registrar, present the patient, examine it with the registrar, and then they'll move on to the next patient. So it was much more of an autonomous role, which as a nurse practitioner really appealed to me because I was ready to sort of take the next step. But we still have quite a divide between what the nurse practitioners are doing in the specialty services, so what I was doing in colorectal, to what's happening now in ASU. And so ASU's become a more attractive place to work as a nurse practitioner really because there's a chance to really expand your skills there. Yeah, because I've done like normal social hours for a couple of years at that point. I think because I was, at the same time I was making the whole of my team move to weekend working and we had a rota, and I was so keen to promote it as a positive thing. I don't really reflect too much on what I thought about it because you had to lead kind of from the front, and I was the first person to work on Christmas Day for our team, and it was kind of nice to lead the way and be positive about it. To be honest, it didn't have a massive impact on my life at the time, and all of my team have taken to it fantastically in the last 2 years. All the nurse practitioners all work weekends now. They fight over which weekends they're going to work. They're more than happy to do them. They get a bit of money enhancements. That's always a bit of a bonus, but it's not a massive amount. And that's been the easy bit really. I think the benefits really what most people have seen is just the better continuity for patients, and the support of the junior doctors, and that they're working with someone who's a very experienced nurse with some advanced skills who can really just facilitate them, help their learning as well, and support them. So I think they do get quite a lot of positive feedback from the medics as well as the consultants. And then when it comes to a Monday morning, there's people that know about those patients and then can move them to the right places and make sure things are closed up, that people have gone home and followed up correctly, that kind of thing. They've really been able to come up with lots of ideas for sort of more quality improvement as well, because they've been around at weekends and see how things do run completely differently. So they'll say, this isn't working, could we look at this, could we do this for budget setting, and nurse practitioners really come up with some good ideas, which we never would have had if they hadn't been there observing it really. And so when Mr. Bailey started his model, what worked so much better was we were seeing all of the same patients every day, the same types of patients, so you start to learn so much more about the acute presentations that any team would ever crack before. We realised that there were lots of patterns with what was coming in, and therefore we've been able to really push with ambulatory pathways and things like that, because we could see, in concentration, where the problems were. So when we first started it was extremely challenging because there just wasn't really enough of us for the volume of patients, and the volume of patients has now gone up. But actually, over the last 4 years, it has been invested in, not as much as I think Mr. Bailey would like, but it has enormously been invested in, and runs much better now because you've got this dedicated team who are experts in emergency surgery and emergency type presentations. And they've also really used the nurse practitioner model sort of more effectively than in the other specialities, in that they've got nurses, well, myself included, who can clerk patients and basically completely act as a junior doctor to make decisions and progress patients, which again has prevented waiting times, people hanging about for drugs, discharge summaries, etc.